Yeah, well, it's a very different place we're in now than many of the predictions. You're right there, Chris, and I think it's a real credit to not only, as you said, the Prime Minister, the state premiers that got together in that national cabinet, an unprecedented wave of everyone working together at that high political level, but also the medical profession and nurses and all of the health staff all around Australia have done a fine job. But I'd say also the whole of Australia, because so many people have got behind the various things that were really interfering with life quite a lot in the last few weeks, the social distancing measures and so on. And taken that message on board, that really understood those messages, really took it to heart. And it's a credit to all of us to see where we are now with so few cases each day.
I think you're right, and if you don't mind me saying so, credit to you, Brendan Murphy, and your colleagues as well, because you've stood up there and given us this information day in, day out. I know a lot of my colleagues in the media have been nitpicking over this and that. Why can't I go to work when my kids can go to school? Why is this beach okay, that park's not? You know, it hasn't been much fun for you, but you're still doing it, and it's very important work, and we appreciate it. On that, we're starting to see the relaxations now. There's more to come. We all know any second wave is a real worry. Tell us how deep your concerns are about that, because you'd have an eye to history, of course, and the way that in the Spanish flu, the second wave did most of the damage.
Yeah, so people are starting to compare this with Spanish flu in many ways. Certainly the number of cases around the world is mind-boggling, really, over 3 million now, as you said in your promo, and 200,000 deaths. So that's extraordinarily large pandemic in a very short period of time. But of course, most of the world remains non-immune, and so we are all at risk of a second wave of the pandemic. And that's why the increased testing capacity that we've built up over the last little while, and including the announcement today by Minister Hunt and the Minderoo Foundation in providing 10 million tests for us to be able to find and put into quarantine and look at contact tracing around every single case if that second wave did come. So I think we're very prepared. The other thing I'd say about the second wave of the Spanish flu 100 years ago was very much related to mass movement around the world after World War I. So returning troops from Europe to North America, to here in Australia, to New Zealand, where they carried the virus, unfortunately, back with them, and that was what set off that second wave here in Australia. And so our border control measures that were put in place very early on are likely to continue for quite some time because of that. And that's one of the key components of our control.
There are a few different aspects to your strategy. What you're talking about there with testing and tracing through the app is about making sure we find outbreaks and suppress them quickly. Of course, there's research going on to treatment with antiviral drugs and the like, but also then there's the push for for vaccines. How encouraged are you by the news today out of the University of Queensland suggesting that a vaccine could be available from Australian research in September? Is that overly optimistic?
It's very optimistic. Whether it's overly optimistic or not, I'd defer to the University of Queensland researchers. Look, there's a number of very rapidly developed potential vaccines, I would say. The word potential there is very important. Over 100 different types of vaccines that may be developed, but you have to realise that these are very early stages in vaccine development, and even though that's come on very quickly as much of the progress of this virus, positively and negatively, has been very rapid, so indeed the start of vaccine research. But it's a long way to go before that could be found to be scaled up and used in any large way in populations around the world, including here in Australia. But yes, it's very encouraging that that progress is being made, and the University of Queensland in particular has a quite unique way of making vaccines, which, if successful and safe, then it will make that time period shorter. But it's a long way to go yet.
Yeah, given those realities and the fact that you have to plan for not having a vaccine effectively, to what extent do you think we can open up society in Australia behind those secure borders? So still have the quarantine in and out, obviously, but if we have extensive testing and there's a good take-up of the app, Can you see a time in the not too distant future where even restaurants and hotels could be open with special rules?
Look, there's a range of possibilities. I think you're spot on there about what capacity we needed to build up over the last little while to allow that social distancing to be relaxed. Certainly an ability to find cases, so that laboratory testing is very important, and so that's really locked in now, and we've got plenty of laboratory capability, and that's fantastic. We needed to prepare for the worst, and that was building up our intensive care capacity and other capacities within our healthcare system. That's another tick. The third one is really ramping up our public health capability to find cases, but also to find their contacts quickly. And the app that was introduced over the weekend and now has over 10% uptake for Australians. Well done again, everyone coming on board to do their part here to protect ourselves and the wider society. But that app is just part of the larger normal case finding and contact tracing exercise that we do so well here in Australia.
But the reality...
So we've got all those things, then we've got the borders, yeah.
The reality is, Paul Kelly, that we may have to learn to live with this virus. We may need to come to an arrangement of rules and testing and tracking behind secure borders that can sustain beyond a year.
Yes, I think this is going to be a new normal. We have the ability to have a COVID-safe society here in Australia, and that's certainly where we're heading at the moment. And the Prime Minister, and indeed Prime Minister Ardern, has also said the same thing, that maybe that ANZAC spirit may be able to be renewed in some way as a COVID-safe region. Because New Zealand is doing very well as well. But there'll be changes that will probably be semi-permanent there, I think. But in terms of opening up society, that's definitely the idea. And the more people that take up the app, the more likely that will be able to be accelerated. And I think going slowly over the next few weeks, and Prime Minister Morrison also stated a date today and confirmed that May 11th there'll be announcements about that, and the National Cabinet will be meeting several times between now and then to really look at the AHPPC advice and economic advice as to which things to open up first. And so there'll be announcements about that in due course.